mother, if we're going to have healthy pregnancies, if we have a policy that negates science that says spacing is important in the reproductive health of the mother, but as importantly, the health of that embryo, that child that may be born, then we're not doing our best to ensure that we don't reduce death and chronic disease amongst infants. So I guess getting back to supporting policies at the state level that will ensure that we have a full complement of reproductive health services for women so that we can reduce infant mortality in the state of Ohio.
Chairwoman Jones, Senator, without going through a complete list of what those services may be, our policies will be based on the law and on science, and we will deliver services that are most effective in reducing infant mortality. And I don't know how to be any clearer to say those are the only priorities we have.
Madam Chair, just a follow-up. This goes to Medicaid. You talked about managed care. Certainly our Medicaid program promotes managed care for those who are part of our Medicaid health care program, and many of us are very proud that the governor and the legislature found a way to expand Medicaid in the state of Ohio so that we can insure more people. Again, the more we get people into a regular health care environment, the healthier they will be and the less premature death and disease that we'll see. The solution was temporary, however. My question to you is whether you support maintaining the existing expansion of Medicaid to those more than 134,000 people around this local community, the 1.2 million statewide, the thousands that now participate in Medicaid expansion, whether you as the director, should be confirmed, support that and help the legislature with maintaining the expansion of Medicaid in Ohio.
Chairwoman Jones said it in fast. Yes, I do support the expansion of Medicaid. I do it from the perspective of the director of the Department of Health. I realize there are other issues outside of my narrow focus that may come into your debate. As the director of the Ohio Department of Health, I do support Medicaid expansion. I've seen what it's done for people, especially vulnerable people. People who are trying to work their way out of poverty. It's helping them. I've seen what it's done for hospitals. It's stabilized their financial situations in many cases so that they can be they can plan better for delivering services in their communities. And I've seen what it's done for the coordination of care for people so that there are better outcomes. I know you talk to your constituents all the time. I would encourage you to talk to folks that I'm hearing from that see it as a success story.
Chair, just one final question. This gets to issues around environmental health. You talked about the role of